Greetings, I'm Dr. Lippy Roy, and welcome to my show, Health, Humor, and Harmony. Today's show is about a genetic disease that impairs breathing and digestion. May is National Cystic Fibrosis Awareness Month, where the CF community comes together to raise awareness for a condition that affects about 35,000 people in the United States and 70,000 people globally. Fun fact, the first medical research project that I was ever a part of was the rat epithelial sodium channel and its role in cystic fibrosis at the Hospital for Sick Children, or Sick Kids, in Toronto, where a major scientific breakthrough was made. Let's start. In the 1980s, life expectancy for someone with CF was about 12 years in the United States. Thanks to a major discovery by Toronto scientists, life expectancy has steadily increased, and today it's close to 40 years. In 1989, a team of researchers led by Dr. Lap-Chee at Sick Kids, which is a University of Toronto teaching hospital, discovered the gene that causes cystic fibrosis, CFTR, or cystic fibrosis transmembrane conductance regulator. Other genes are involved, but CFTR was the first disease-causing gene to be identified in cystic fibrosis. This scientific achievement was a game changer. Not only would it improve the lives of children and young adults with CF, but it also paved the way for what is now referred to as individualized medicine. Discovery of the CFTR gene is considered to be one of the most significant breakthroughs in human genetics, and one for which Dr. Choi was inducted into the Canadian Medical Hall of Fame in 2012. So what exactly is cystic fibrosis? It's a progressive genetic condition where mutations in the CFTR gene impair the body's cells, tissues, and glands that make mucus and sweat. Mucus is normally slippery. It protects the linings of the airways, digestive tract, and other organs. But people with CF make thick, sticky mucus, which can cause three major problems. One, it blocks airways and leads to lung damage. Two, it traps germs and increases the risk of infections. And three, it prevents proteins needed for digestion from reaching the intestines, leading to malabsorption. So what are the symptoms of CF? Depends on the organ affected and the severity of the disease. Some people have few or no symptoms, while others have life-threatening complications. Since CF most commonly affects the lungs, respiratory signs and symptoms include wheezing, persistent cough, coughing up mucus or blood, and frequent lung or sinus infections. GI symptoms include diarrhea, constipation, or severe abdominal pain. Other symptoms include salty tasting skin, poor growth during childhood, male infertility, jaundice, joint pain, and clubbing of the fingers and toes. How is CF treated? While there is no cure for CF, according to the National Heart, Lung, and Blood Institute, advances in treatment are enabling patients with CF to live longer and healthier lives. A multidisciplinary healthcare team consisting of a doctor specializing in lungs and digestive system, genetic counselor, nurses, nutritionists, pharmacists, psychologists, physical and respiratory therapists, and social workers will ensure an individual with CF gets the appropriate care. Treatment options include airway clearance techniques, which help loosen lung mucus, reduce infections, and improve breathing. Medications are aimed at improving lung function and breathing and reducing lung infections. And they include antibiotics, anti-inflammatory meds like ibuprofen and steroids, bronchodilators, mucus thinners, and CFTR modulators like ivacaftor and lumacaftor. Surgery may be indicated in patients with advanced disease, including a lung transplant for people with respiratory failure and a liver transplant for cirrhosis. So how can you get involved? Here's your call to action. Share facts about CF on social media using hashtag CF Awareness Month. You can also donate to or volunteer with the Cystic Fibrosis Foundation, the CF Center at Sick Kids, Cystic Fibrosis Canada, and the American Lung Association, as well as many more. Well, that's all for today. And here's your joke of the day to start your weekend right. Why is Friday a happy day? Because the next day is a Saturday. I'll see you on Monday, 3 p.m. Eastern, when I'll discuss Hepatitis Awareness Month. Be sure to subscribe to my YouTube channel and write comments below and follow my Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.